Hey everyone, this is the introduction to the wet lab curriculum that we're having this coming spring. The initial session here is going to be on the assembly of the wet lab materials. The strabismus materials are located in the red box in the upper right hand corner on the shelf with the other wet lab materials. Inside the box are a number of materials. On the far left-hand side, there's the surgical head. The middle has three boxes here that have the globes with muscles. Top right has the instrument trays with all the instruments you'll be using, and bottom right has the orbit module. Inside the instrument tray has all the materials that you'll be needing for the strabismus wet lab. These are most of the materials that I have on my surgical table. Included at the top is a caliper, followed by a locking needle holder, a hemostat, two locking .5 forceps. The bottom half are two Bishop Harmon forceps, a blunt tip Westcott's, two small Stevens hooks, and two large Jameson hooks. When you're done with your session, make sure all the instruments are back in the proper container. There'll be a checklist to make sure you have all the instruments. These three boxes contain the globe and muscle modules of the wet lab. The top box has 18 basic squint sets, which is a globe with 4 rectus muscles without conjunctiva. The middle box is 9 advanced modules with the superior oblique. This has conjunctiva and a superior oblique tendon. And the bottom one is 9 advanced modules with conjunctiva in the inferior oblique. Here's what they look like inside. The top module here is the basic set with 4 rectus muscles. The bottom set is the 9 conjunctiva plus inferior oblique modules. Here's the head model. There's an overlying sleeve that's either black or silver. I don't think this adds much to the module, so I usually leave this off. When you remove the sleeve, there are 3 other components. The facial plate is on top here. When you take the face off, there's 2 more components that comprise the base. We have Velcro here to secure the face to the base. The Ziploc bags contain the orbital portion of the model. In addition, there's an insert that can cause more or less proptosis or enophthalmos in the model. This is a view anteriorly of the orbital model. The insert's in the base here, and you'll see 4 openings for the rectus muscles to come out. There's a mark at 12 o'clock in this picture that can be oriented in any direction in the orbital model. Placing the globe model into the orbit, I've placed 2 of the rectus muscles through the holes. The other 2 are still outside. When all 4 rectus muscles are inserted through the holes, this is what the model looks like. In order to keep the globe centered, it's helpful to secure the muscles behind the orbital portion with a hemostat. You can vary the amount of resistance on the muscles by varying the tension at the hemostat. When the muscles are threaded correctly, the orbital portion can be inserted into the base like this. You can then put on the face plate to complete the assembly of the strabismus wet lab. The globe is then ready to perform any of your simulations on. Moving forward, we're going to have 5 or 6 sessions looking at simulating strabismus muscle surgery in the wet lab. This first session is assembly. Next possible session will be rectus muscle isolation, followed by rectus muscle recessions. After that, strengthening procedures like resections and plications will be demonstrated. We'll then move to operating with the conjunctiva of the advanced models to allow us to practice with that. And finally, we'll do oblique muscle isolation. I think this is going to be an exciting time to practice our strabismus surgery in the wet lab to improve our technique in the operating room.